at 745. Out of this number, 98 of them have been discharged after completing the 14-day follow-up period. We now have remaining 647 close contacts that our tracing teams are monitoring. 15 individuals are currently admitted at Bagathi Hospital waiting test results. Following our directive on the 22nd of March 2020 that all international travelers arriving through our entry points that are undergoing mandatory quarantine in select hotels, government designated facilities, and so on. I want to state that there has been challenges, particularly at the Jomo Kenyatta International Airport, as well as the designated hotels and government facilities, where we are taking the travelers for mandatory quarantine. This was bound to happen because of the huge numbers that are coming in, while at the same time we do not want to leave anything to chance. However, we have streamlined the process and this has been sorted out. In fact, we intend to introduce further measures to speed up the process and ease the inconvenience that we are clearly causing a lot of parents and a lot of passengers. I want to once again appeal to all travelers to bear with us as we continue to undertake this process. This intervention is aimed at stopping further introduction of virus in the country. And if you needed evidence that this is the case, just refer to what I've just said. On the better side of things, today we have received a donation of 25,000 testing kits for the coronavirus from the Chinese business magnate Jack Ma. On behalf of the government, I want to thank this gentleman for his generosity, as this will go a long way in helping us fight this disease. I also want to take this opportunity to thank those in Kenya who continue to support the government initiative, the business community, the parastatals and their boards, who continue to build water points, who continue to contribute towards resolving this issue. So we have both got international and national support. We shall continue to carry out mandatory testing for all contact cases, for all travelers who have arrived in Kenya, and generally speaking, we are going to increase and fast track our testing processes. We will not necessarily have to be very suspicious. We only have to have a contact and we carry out testing. And this fast track testing might be the solution. We are also looking at possibilities of acquisition of fast testing kits and are in discussion, particularly with the Chinese government, on this issue. You will all appreciate that getting anything connected with coronavirus from anywhere in the world is now a challenge and difficult. But we are also exploring the possibilities of supplementing what we are importing with local production, particularly in masks, in uniforms, and other gear. As I conclude, I would like to urge all Kenyans to fully support the measures being undertaken by the government to deal with this deadly virus. It is the only sure way to cut transmission of the virus and mitigate it in our country. I would like to announce that tomorrow we will be announcing further measures as in view and in consideration of the developments so far. So today, I wanted to give the report. As far as the measures are concerned, there are ongoing meetings as we speak. I'm going to back into one. And tomorrow we will be able to announce what further measures the government has decided to take to respond to the environment and the situation that is now presenting itself to us. Thank you very much, ladies and gentlemen.
Yes.
From KTN. What is the health status of the first cases that were diagnosed for COVID-19? How are they progressing?
We are happy, at least that's a happy note for us, that most in fact, except for two cases, except for two elderly gentlemen who are not completely sick. I mean, they are not in ventilators or anything, but they have shown signs of being unwell. The one in Kilifi, we actually flew a ventilator, for them yesterday, and from what the reports I got this morning is that the Frenchman is responding well. But all the other people that have tested positive are okay. We think we might have some good news, but we don't want to start announcing things and then start going backwards. But keep your fingers crossed. I think soon we could actually be happy about what we are receiving. But for now, I want to leave it there, and I say that somebody's prayers are being answered.
Just question moja, swali moja tu.
Okay, my second question was about the temporary measures that the government is trying to take, especially when you tell Kenyans to stay at home. We know that there are many Kenyans who live from hand to mouth, and we've seen cases of police even using force to disperse Kenyans who woke up early to look for that daily bread that they're looking. Yes, we know we're in a dire situation, but what temporary measures is the government taking to ensure that these Kenyans are really pushing?
Well, as I said yesterday or the day before, I said that every measure we take, we'll have a countermeasure in terms of government effectiveness. Anything else?
Neto?
Yes, Steve.
You mentioned 4 counties already. Has the ministry identified high-risk areas for the COVID-19 with regard to the contracts that you're already pursuing? And there are people who are having home classes for their children. Is that allowed, bringing teachers to the houses for tuition for their children who are at home?
We have said before that the kids were not sent home on holiday. The kids were sent home for protection. And let me just say this, for clarity. Let me just say this. We are suffering from cases of indiscipline. And Kenyans are exhibiting a very indisciplined behavior. And this is going to cost us. When we tell people, keep your kids safe, we don't mean you keep your kids safe by bringing somebody in who, for all you know, is coronavirus positive. We are telling you to keep your kids home with you, at home, not exposing them to the disease. That's why they are home in the first place. So, Steve, you need to tell them. You are the one in the media. Tell them. It's a grievous mistake for us to give you your child because we don't want the child exposed, and then you go exposing the child at home. And then afterwards, you call us and say, Serikali's idea. It doesn't work. This is one time when you idea, the government owns idea, because the government cannot help each and every home and every child. We want responsibility among citizens.
Question is the high-risk areas.
On the high-risk areas, we have identified, indeed, certain counties that we feel, and indeed the 4 counties that I have counted: Nairobi, Mombasa, Kwale, Kilifi. We have always felt that these counties have got extra exposure, and we have also taken measures in those counties to create extra capacity and extra response mechanism, than would be in other counties. But let me just say this. It is important for us to keep recognizing that if we tell people to do things and they don't do them, If we tell you that a matatu should have 8 people, and then you do it when you are being watched by the police, and then when you leave the police, you go and start doing it, you go back to normal. It is unfathomable. It is difficult to understand what you are trying to do. Are you trying to kill yourself, or are you trying to kill the people that you are carrying in your matatu? That's a question one needs to answer. The other point that I would like to make, and this is connected with our the travelers who we have kept in quarantine, is to say that the hotels that these people are staying in must not take advantage of them. It is immoral, and I repeated it the other day, it is immoral to take advantage of persons who have no choice. If anything, what they should be telling us is that this amount is just enough to cover our costs. That's what they should be telling us. They should be sacrificing and saying to us, let's pay only this much, which covers the food and generally the operational costs. But to add on huge profits on the backbone of suffering Kenyans is really, really unacceptable. So I'm appealing again to those handling the travelers, to those handling those in quarantine, to exhibit patriotism and generosity and consideration so that we don't add insult onto injury.
Just one. Yes.
In terms of the stage at the level of transmission, are we at the horizontal level where it's now becoming local infection? Are we at this particular time? And how difficult and prepared are we in terms of getting that particular infection from local to another, local and individual to a community? That is just one. And then number two, of course, we have law enforcement who, are some of the people on the front line trying just to maintain law and order in terms of social distancing and to make sure that some of the regulations put by the ministry is effective. But how safe are they? And what kind of data are using? Are they well equipped in terms of observing the medical equipment?
Thank you very much. Let me start with the last one, law and order. First and foremost, we have been carrying out training of the police, particularly the traffic police. At the appropriate time, they would obviously know what to do because they have had this training. But as the situation unfolds, then we might require them to do a little bit more than they currently are doing. And as for local to local, at the moment we are still talking import and contact to import, and therefore we obviously, and the situation is unfolding. It's difficult to tell right now. Having not carried out all the tests that we need to carry, it's very difficult for me to confirm with you what exactly that situation is. But at the moment we haven't really tracked to that level. So I want to once again reiterate our thanks to the medical fraternity. The equipment that we received today, in addition to the testing kits, will go a long way to ensuring safety of our health workers, and I want to emphasize that's a key. It's a key consideration for us. And as you know, we also have people, not just the ones you see. We have people in labs who are working very hard, and this testing I'm talking about, they are the ones who are carrying out. And I don't know, ladies and gentlemen, whether you know a gentleman called Mamo Umoro, the head of the national. Where is Mamo? Oh, he is here. This gentleman you are seeing here, the head of the national laboratory, he is the one who is carrying out a lot of tests. And you are telling me that we are now improving to how many?
We have the capacity now to test all the labs, 300 samples per day within 24 hours. Within
24 hours now, they have uplifted capacity to testing 300. So what we are saying is that even to test the ones that we are seeing is not that difficult. We obviously want to improve that so that if we get the new testing kits, then you'll be able to test in 45 in 45 minutes, which is going to really fast track the testing. However, we are also being careful. We don't want fake testing kits being dumped here, and then we are testing people and saying they are positive, they are negative or positive, and we have no idea. As you know, this has been done before. Stuff has been dumped onto Kenya. And anybody wanting to sell things here has two questions to answer. Number one, is it being used in your own country? Because if it is not being used in their own country, why would they be bringing it here? Why would we be testing our people? We are not exactly guinea pigs. The second question, is it approved in your own country, and is it approved? Does it have a WHO status? If it doesn't have, if the answer to any of those questions is no, then we are not interested. If the answer to both questions is yes, we are definitely interested. And that's when we would fast track it, airlift it, if we can get them, because that is the other challenge. The other lab that we are also using is KEMRI, as you are aware, which has established many centers. And also with us here from KEMRI is Rutomia Joel. Is he here? Rutomia, where are you? Oh, you're also on this side. That gentleman is also working very hard at KEMRI to ensure that what we send to them is tested immediately. And I realize that we had a couple of issues when we started, but Rutomia, maybe you can tell them you are capable of doing this now.
Yeah, thank you, sir. Currently, the KEMRI laboratories have a capacity of testing 350 samples.
Say from here.
Okay, thank you. Currently, the Kenya Medical Research Laboratory has the capacity to test for 360 samples in a given day, that is 24 hours. We have the machines, we have the personnel who are well trained, and we have the kits. So the country should rest assured that any samples that comes to us, I think, will be tested, and the results will be relayed to the public within the shortest time period. Thank you.
Thank you. Thank you very much. I'll ask the Director General, Acting Director General of Health, if he has got something to add, but for me, thank you all very much. Are you here?
Thank you, Waziri. Just to add on to that, we are also working very hard with Moi Teaching and Referral Hospital to be able to establish another testing facility in the North Rift that can be able to serve the North Rift countries. Therefore, as we go ahead, we are going to be able to deploy testing to the county level so that we can be able to have a shorter turnaround time and therefore quicker decision making, and to reassure Kenyans about their COVID-19 status. And finally, just to appreciate once again the hard work done by the healthcare professionals from the Port Health, the people in the lab, the clinicians, the doctors, the laboratory guys who are doing a wonderful job working under very difficult circumstances to be able to deliver these results to allay the fear and anxiety of Kenyans. And of course, the support that Kenyans from all walks of life have extended to us during this difficult time. I know it is a difficult period for the nation, but together we shall overcome if we hold our hands together. Thank you.
Waziri ameshaongea bwana. Waziri ameshaongea hapana.
Scott of God.
Yeah. Na mimi nitaongea na nyinyi hapo. Waziri ameshaongea.
Miriam Sidibe.
Ladies and gentlemen, I have a surprise because I just met William Sidibe. Apparently, she is probably the only PhD in hand washing that you have ever seen. So I would like her to demonstrate. I wish we had water, but even without water, she's just achieved a PhD. She doesn't need water to demonstrate. Please demonstrate.
Thank you very much, Your Excellency. Yes, indeed, I have a PhD in hand washing from the London School of Hygiene and Tropical Medicine. I'm currently a senior fellow at Harvard. What I currently would like to demonstrate is what is important for the nation to remember in terms of hand washing with soap. What you need to remember is that you need to wash your hands regularly. It has to be thorough hand washing with soap and water, and that there is 7 steps to it. So very important that you remember that it has to be at least 20 seconds under running water. You need to make sure that obviously you have the soap. A bar or a liquid works perfectly well. Any soap is good for that. Just remember that at the same time. So you take the soap, of course. Imagine there's a soap. There's running water. You can watch my TED Talk. There's the only TED Talk in the world on hand washing with a couple of million views as well. With running water, you rub it on. You make sure that you wash inside with the running water as well. Then on top, as well, make sure that your fingers and inside your fingers are well washed, as well as every part of your fingers as well, and this should last at least 20 seconds. A good way to remember this is to sing happy birthday twice when you want to wash your hands. That should be able to do it. And make sure you keep running water as well. That's absolutely critical. Hope that works.
Now that I'm on your side for a change instead of this side, and by the way, our father happens to be Minister for Health in Mali. I want to ask you a question. Is it true that one can use ashes to wash their hands? Oh, yes. Is it true that you can wash ashes to wash your hands?
Yes. Yes. The evidence says that basically what's important is the abrasive movement in the soap. The abrasive movement in the soap allows you to remove the viruses. And as we know, coronavirus falls in the category of what we call the enveloped viruses, which the abrasive situation with the water and the soap removes the virus and kills it and removes it from your hand. You can use ash, but what we have also found, and the data is showing that you'll find that ash tends to be contaminated with E. coli. So we do think that hand washing with soap is the #1 solution that we provide. And any soap that is, a toilet bar, a laundry bar, all of that will work.
Thank you. Voila.
Thank you, Miriam. Thank you.
Thank you. Namaste.